Let's begin this live broadcast by bringing you the latest COVID-19 updates from the United States. The pandemic continues to escalate in the US as the country recorded more than 68,400 cases in the last 24 hours. This is the highest single-day surge recorded anywhere in the world. And the United States has now reported nearly 3.7 million cases. The country has seen a resurgence of cases in the so-called Sun Belt, stretching across the south from Florida to California. 5 major states of Arizona, Texas, California, Florida and Oklahoma continue to see a massive surge, with at least 39 states pushing back their reopening plans. The surging coronavirus cases have also led to a shortage of hospital beds in these states. But with a new record daily caseload, the U.S. states have now issued a conflicting order on face masks. Colorado and Arkansas joined a growing list of U.S. states requiring face mask coverings in public places. This is in direct contrast of their previous stance, where they treated the wearing of masks as a matter of personal choice. With the record surge and the U.S. hospitals under strain, President Donald Trump now continues to advocate for his administration's handling of the outbreak.
When you think of it, we are all set up that as we get the vaccine or therapeutic, and we're set up militarily, we're going to be delivering it in record time. It's all set to move. We put an investment up front, and we have logistical people, generals, great people. They're going to be delivering this all over the country as soon as we have it, and we've made tremendous progress. You've been reading about it.
Meanwhile, amid tensions with the president and his administration, the top infectious disease expert in the U.S., Dr. Anthony Fauci, interacted with Facebook CEO Mark Zuckerberg on the country's response as well as the race for a vaccine.
At this point, it is clear that the trajectory in the U.S. is significantly worse than many other countries, and that our government and this administration have been considerably less effective in handling this.
If everything works out the way we hope and we don't get any unpredictable potholes and bumps in the road, we should know as we get into the mid to late fall, early winter, but probably late fall, whether we have candidates that really are safe and effective. And I hope and anticipate that we will have one or more. If that's the case, by the time we get to the end of this year, the beginning of calendar year 2021, we may have vaccine one or more candidate that is actually safe and effective.
Now, for more insights into these developments in the United States, Jagriti Dave is joining us live from Washington, D.C. Welcome, Jagriti, and thank you so much for joining us. Now, the U.S. has been reporting its highest single-day surge for the last few days, and the total case count is nearing the alarming 3.7 million figure. So where is the administration faltering? Could the surge be attributed to a somewhat hasty reopening of the economy?
That is indeed one of the reasons that some of the critics of the administration are putting forward as suggestions as to why we're seeing this surge in the number of cases across the Sun Belt, as you mentioned, in states like Texas, Arizona, Florida, California. There are huge concerns in many of these states about the state of hospitals, with beds reaching capacities, with ICUs reaching capacities, and so. That is one reason, the push, the drive coming from the federal government, coming from the Trump administration for states to reopen, and for that decision to be laid at the door of state governors. So some states like Texas, like Arizona, did push forward. And some of those officials, mayors in Arizona, saying one of the reasons why they're seeing this is because they reopened far too early. And another reason that's been given is in places like California is that perhaps people have not been maintaining the social distancing as stringently as they should be, that they maybe haven't been wearing face coverings. There has been across the country, it turned out to be quite a divisive, and it ended up being a very political issue about the wearing of face coverings. It's sort of split between people who adhering to the health guidance, the CDC guidance, that it's beneficial to wear a face mask in public, and those who believe that it's an infringement on personal liberties.
Right. Now, I'd also like to discuss the reopening of schools, which is a very controversial topic in the U.S. as of now. The White House press secretary argues that science is on their side when it comes to the reopening of schools amid the outbreak, and health experts strongly disagree with this assessment. So the question remains, amid this surge, is the U.S. really ready to reopen schools and other educational institutions?
So there are teachers, health professionals and educationalists who are concerned that the United States is not ready to reopen schools. Firstly, there's not enough that's known about the transmission of the virus amongst children. Evidence shows so far that it does not affect children in the same way or as significantly as it does elderly people, older people and people with underlying health conditions. Right. That is evidence that the Trump administration is using to underpin its push to reopen schools. But there's still not that much that's known about really the health implications for children. But also there are worries that the virus spreading in schools, the children could then bring it back home to their families and to vulnerable members of their communities. There's questions about the cost of personal protective equipment that might be needed for schools and teachers, how they would go about the logistics of implementing social distancing is another problem. So a lot of schools and teachers and professionals are worried about it. On the other hand, the administration is pushing for schools, saying that face-to-face learning is vital. It's part of the administration's push to get the country reopen again. Like mask wearing, it seems to have become somewhat of a political issue as to how the country moves forward.
Right. Once again, let's just discuss this issue of wearing face masks and why it's become a political statement in the US and a flashpoint between the Trump administration as well as his opposition. Why is there this discrepancy in the message being sent out by different states about how important it is to wear a face mask, while health experts as well as different studies seem to suggest that wearing a face mask, in fact, reduces the risk of infection by a huge margin?
Well, first of all, in the early stages of the pandemic, it wasn't clear. Wearing a face mask was not official health guidance. It was not official CDC guidance. And that was only implemented later on when more became known about the virus and the numbers and just the sheer numbers kept going up. And that was a guidance that was instituted a bit later. But also critics are saying that this is the reason for this discrepancy is because it is left up to states to make up that choice. This is not something that has been mandated nationwide by the Trump administration. This is something that Democrats like Nancy Pelosi are saying there needs to be a nationwide mandate to wear masks in order to make sure that everyone adheres to the health guidance. So it's left up to states. And now even state governors differ on this. And so you can see this real political flashpoint happening in the state of Georgia, where the governor of Georgia, Brian Kemp, is suing Atlanta City Council and its mayor, the mayor of Atlanta, Keisha Lance Bottom, for her decision to keep mask wearing in place in the city, despite the fact that Brian Kemp, the governor, signed an executive order very recently saying that the governors, the statewide directive, which is that there's no mandate for masks, should override any local mandates. So it's really not even on a statewide level. It's left up to local counties to decide to issue guidance to wear masks. And this is a lawsuit that the governor of Georgia has issued. And he says that this lawsuit is on behalf of Atlanta business owners and their hardworking employees who are struggling to survive during these difficult times. He's citing the economic impact of social distancing, of mask wearing, of shutting down, of all of those restrictions, saying that the economic hit is too much for businesses to face. Keisha Lance Bottom and mayors and local officials who are advocating for mask wearing and limiting gatherings to public gatherings to only a small number, they are citing the public health factors and the official guidance, the health guidance, which is saying that masks are an important tool to curb the spread of the coronavirus.
All right, Jagriti, thank you so much for all your inputs and thanks for joining us for this story.